All right. Karibu sana to the podcast, as we call it. This is a forum that I created so that we can talk about animals and see how we can improve animal welfare. And I do this in conjunction with various veterinarians in the practice. My name is Naomi Mutua, and I am the founder of Cat Lovers Kenya and of the podcast. So thank you very much for being here. Dr. Chibeu, Dr. Mary, thanks for being our hosts today, our guests today. I really appreciate that you've taken the time to do this. So I will start with letting you introduce yourselves, and then we can begin the session. Dr. Agutu, I will let you go first.
Okay, good evening. What are they? They are cat lovers?
Yes.
Okay, okay, so my name is Dr. Mary-Theresa Agutu. I am a vet. I graduated in 1996. I have also done a master's degree in medical virology. I work at the board as an assistant manager in charge of quality assurance and working under education. So I am in charge of supervising training. And so training includes from the time you're admitted into college up to the point at which you graduate, you go for internship, and then you have to retain yourself on the register. So you keep training as a vet. So I don't do any private practice. I only work at the board as a regulator.
Okay. Thank you very much. Dr. Chibeu, karibu sana. Please introduce yourself.
Thank you very much, Naomi. And thank you very much, MTA. We call her MTA. I am Derick Chibeu. I'm a veterinary surgeon currently based in Karen at Sacom Veterinary Surgeons. I was privileged to be peers with MTA. She graduated a year before me, so I graduated in 1997. Basically, I have 25 years experience, mainly dealing with dogs, cats, and horses, an occasional cow here and there, and some exotics, as well as some wildlife. And I wear many hats. I am the chairman of the Kenya Small and Companion Animal Veterinary Association. I was elected to the Kenya Veterinary Board as a director. I'm a co-chair of the World Small Animal Veterinary Association Professional Wellness Group Committee. I am the continuing education coordinator for Sub-Saharan Africa for WSAVA. And then I'm an AFSCAN ambassador. AFSCAN is the African Small Companion Animal Network ambassador for Kenya. For this purpose, I think I will be here speaking mainly on issues that touch on KESCAVA and the general companion animal practice.
All right, thank you very much. It's a very impressive resume from the both of you, wearing various hats, and thank you for all that you do for us and for the animals. So we'll start with Dr. Agutu. Sorry, Dr. Chibeu. Maybe you can take us through what it takes to be a veterinarian, encompassing how many years you have to study, what fields of study there are available, and what kind of practice then that you need to do to qualify.
Let me start by and probably MTA will come about and give a better categorization of this. But the veterinary profession in this country can be divided into one, the veterinary surgeon, two, then you get the veterinary technicians. Now the veterinary technicians are further divided into three categories, where there's a veterinary technician who basically is a degree holder, and then there's a veterinary technician who's a diploma holder, and the veterinary technician who is a certificate holder. And all these undergo various different durations of study. Well, to start with, the veterinary surgeons, as they are called, would definitely do a course of 5 years, basically learning at the university, plus 1 year internship. And then the veterinary technician degree holder will do a minimum of 4 years and also required to do an internship. And also then you've got the veterinary paraprofessional diploma, which is at a minimum of 2 years. And I think a veterinary certificate is now 6 to 12 months. MTA will probably correct me if I've said something wrong. But in essence, when you're looking at the veterinary surgeon, who is probably at the apex of all this, he does undergo quite an intensive course, as much as it is widespread. So you're looking at, first of all, being able to be competent in the basic sciences, which are your basic anatomy, physiology, biochemistry. So your basic biological sciences for a minimum of 2 years, usually. And then you move on to the clinical years. The clinical years is when you now move on to your 3rd year to 5th year, where you're doing your more clinical subjects, your parasitology, your microbiology, your pharmacology, your medicine, surgery, obstetrics and gyne, and of course then your internship, where basically it's supposed to be a practical year, getting you to grips with issues to do with what happens out there in the world. And the internship involves a serious rotation from the clinical aspect of veterinary practice to actually policy, lab work, the whole works, so that you end up with an all-round person. It's a tough course. I can assure you that it's not as easy as most people would like to believe. And you have to master systems that are ever increasing. Initially, I think we used to start out with 7 domestic animals. Now it's completely increased, if you're including the furries and you're including the wildlife. So it does take quite a toll on a lot of people who take veterinary medicine. And then, of course, there's further specialization after your undergraduate degree, which mainly will lead you to specialized areas where you go into either public health, clinical practice, and even in clinical practice, specialized areas like orthopedics and special medicine, and the rest of it. But basically, it's a wide course. And after 6 years, it brings out an individual who is quite knowledgeable, an asset for a country, and quite expensively trained, actually, I must say.
All right, that's very intensive. I don't think some of us might have cracked that if we had tried. So well done to all the vets out there who've graduated. Dr. Agutu, do you want to add on that before I go on to the next question?
Okay, so we have the veterinary surgeons who have done Bachelor of Veterinary Medicine. We have 2 colleges. We have College of Agriculture and Veterinary Sciences at Kabete, University of Nairobi, and we have Egerton University also offering Bachelor of Veterinary Medicine and Surgery. All those who graduate from there are veterinary surgeons. Then we have the paraprofessional cadre. That includes the Bachelor of Science in Animal Health, who are then called veterinary technologists degree. Then we have the Diploma in Animal Health and Production, who will eventually be registered as veterinary technologists diploma. Then we have the certificate holders, who are registered as technicians. So we have several colleges who train these cadres. And of course, as the board, having been mandated to exercise supervision of our training, we first look at the programs, the curriculum, the facilities, the trainers, the practical, the laboratories and the classrooms, and we certify that they are able to meet the threshold for minimum training requirements. So with all those, we accredit or approve training institutions that will then train these various cadres of professionals. And after that, the students, once admitted, within 1 month are required to be indexed. So by indexing, we have a traceability that yes, this was a student in this institution and they did their training. Certificates do minimum 2 years. Then we have diploma, 2 to 3 years. We have degree, as Derick said, around 4 years. Apart from those, we have other certificates in between. There are those who don't do courses that are registrable. For example, range management, wildlife management. Those are allowed to undertake a 1 year prescribed by the board to be upgraded to certificate so that they are made registrable. Then we have a new course that is upgrading to diploma that is only open for those who have done certificate in animal health. So with that, those courses, then you can be registered as a diploma holder. So I think that's the addition, but yeah, it's intensive work and full-time courses. There are no part-times. So yeah.
Okay. I was just going to ask about whether there's any full-time or part-time, but you've answered that. Is there any kind of course where one can train as maybe a nurse, or do you just have to do the basic either certificate or a diploma to qualify maybe as a veterinary nurse or something like that, as an assistant?
Currently, we don't have that in Kenya. Of course, it's something to look into, but for now, it's a basic certificate or diploma. Or, yeah, so we don't have nurses in Kenya. We don't have that cadre yet.
Okay. All right. So going into KVB, maybe Dr. Agutu, you could take us through the basis of KVB and why it exists and what role, therefore, it plays for both the practitioners and the rest of us as the general public.
Okay. So initially in Kenya, we had veterinary surgeons governed by the Veterinary Surgeons Act, CAP 366, that was enacted many years ago, like in the 50s. Yeah. Eventually, we had to revise that because initially technicians were trained for the consumption of government. All technicians were trained for the director of veterinary services, so they all got into employment after training. But after the privatization of veterinary services, after the, what do you call them? There are some restrictions that were put by the World Bank to allow private practice. Training started being done, and these people were not being absorbed by government. So there was an opening for private training of veterinary paraprofessionals who are not being absorbed by government, so they were not being supervised by government. That then necessitated formation of a law that would also bring them under supervision and of course regulation, so that they do what is right, they offer quality services, and they are able to be monitored. So comes in the Veterinary Surgeons and Veterinary Paraprofessionals Act, which was enacted into law in 2011 to allow these private practitioners also to come into the fold. Initially, there were private vets, but there were no private paraprofessionals. So when we started the SAPS, that season when veterinary services were made to be both private and public good, then the law had to be put in place so that we regulate, who is where, are they competent, are they offering quality services? And also with the onset of those, the privatization, a lot of people opened agrovets and opened clinics, and anybody who had some money would be able to do anything they wanted. And now the law had to come into place so that all these people are in one basket, and we know who is competent, who is qualified, who's out there, and there is recourse for the farmer, for the animal lover, for anyone who's keeping animals, so that whoever attends to their animal is actually known that they exist with where they exist. So I think that is why the law had to be put in place for sanity in practice. And then together with that, the World Organization for Animal Health also monitors and is in charge of trade in animal products and animals. So for purposes of maintaining quality, for purposes of maintaining sanity in that field of animal health, then we had to have an encompassing law that would regulate, monitor, and assure the consumer that this person, this individual, is actually competent and is able to offer service.
Okay. All right, great. Now, when it comes to the indexing, as you call it, of all these practitioners, as you said, they must be registered within a month of their qualification. Is there anything in particular that they need to do to complete the registration? How does that go about?
Okay, indexing is done for students. Mm-hmm. Anyone who enrolls into an animal health program is indexed. And after they are indexed, then they go through their training, and they are followed through training to the point that they graduate. When they graduate, they come back to the board for purposes of being registered for internship. So that index number gives us a fallback to know exactly this one has trained and in which institution and for which course. So they are then registered for internship. And internship is a 1-year on-job training where they interact with the farmers, they interact with the animals under supervision of a registered and retained veterinary surgeon of good standing. After internship, then they come back again to the board for now registration to practice. The vets are registered to practice on their own, but the paraprofessionals are registered to practice still under supervision. So that is why they are referred to as paraprofessionals. So all the three cadres of technologist degree, technologist diploma, technicians are paraprofessionals, and they must work under supervision of a registered vet.
Okay.
So I don't know if I have...
Yes, you've clarified. I'll come back to you in a bit on something you've mentioned. But for now, Dr. Chibeu, maybe you can talk to us about KESCAVA, why it exists, and what role it plays for both the vets and for the clients.
Well, thank you. KESCAVA is basically a branch, and a branch of the main Kenya Veterinary Association. So as you can see, it says it's a Kenya Small and Companion Animal Veterinary Association. Long name, but try to encompass anything that is a companion. And KESCAVA is just about 8 years old now. It was formed in 2014. And it was formed for the main reason of bringing together a growing number of companion animal veterinarians who felt that their needs, as well as many aspects of companion animal practice and welfare, were not being entirely addressed with the traditional setup of the main association through its regional branches. because the setup was that KVA had its branches in the former provinces, what was the then provinces. And then for companion animals, you found that most of the veterinarians were centered around the three main big towns then, and then of course now spreading out. But essentially, it's always along areas where they are kept as pets mainly. So to address this issue, CASCAVA was formed to basically bring together this group, and just like what KVB did in terms of getting laws together for the whole industry, I think KESCAVA came about just to try and bring about sanity, because now we were seeing that there was quite a lot of venturing into companion animals, and we thought that maybe if we all come together, we can agree on certain standards of animal welfare, animal care, standards of practice, how we can care for this group or this kind of animals that are now not just treated like livestock, but they're members of the family, really. So they needed a bit of a special way of looking after. And we thought, well, first of all, start looking after and getting everyone that is involved with the companion animals together, so that we can all have a common understanding. So what role does it play for the veterinary professional, for veterinary profession and the core functions of this association? Well, first of all, we have, as KESCAVA, our vision is that there shall be optimal healthcare and welfare provided for companion animals by a quality, vibrant, and productive veterinary profession in the country. Quite a lofty vision. And of course, the mission is to enhance companion animal healthcare and welfare through an educated, committed, and collaborative community of veterinary professionals. So these two sort of guide what CASCAVA offers for the public, for the profession, and the core functions therefore are to promote health and welfare of animals, all companion animals, enhance, safeguard the interests of and welfare of its members, because as you come together, the interests of members in the profession, whether it's improving standards, helping to basically lobby for a common or subsidized facilities in terms of equipment, to maintain honor, and that way we maintain the honor and dignity of the profession. And of course, another key important thing is that CASCAVA is very big in information, and this way we seek to retain, disseminate, and exchange veterinary information and knowledge with members, both local and international organizations. We run very comprehensive, high quality continuing education programs for our members, and we hope that in the near future, with collaboration with people like you, Naomi, especially people in the in that social media space, we will also be starting to actually provide good information, accurate, factual information to the public about various things to do with their pets. And of course, another core function is to further the advancement of veterinary science and practice. In this regard, CASCAVA is heavily involved with scholarships for members and especially young graduates and people we would like to have do specialty courses, so that we develop a pool of specialists. In the near future, we hope that we can be able to have a pool of especially orthopedics, especially internal medicine guys, especially dermatology guys, especially ophthalmology guys, cardiology guys, specifically for your pets. And this we are striving to do by seeking out and getting scholarships that we can train, especially the younger members of the profession, to go and actively get postgraduate training in it. And one of the most important, if not the least, functions that KESCAVA is involved in is we actively participate in the elimination of rabies and control of other zoonoses of companion animals in this country. For those of you who have seen a lot of our campaigns, we are actively involved with mass rabies vaccination campaigns all over the country. I think that basically brings it to me. Well, there's a question about, is it a must for one to be a member of an association? Being a member of any association is not mandatory, because it is a coming together of people like-minded, and you choose whether to be a member of it. But we actually try and emphasize that for veterinary surgeons that are especially heavily involved with companion animals, and this is part of about 60 to 75% of their services, daily services in their practices, we highly recommend that they join KESCAVA.
Okay.
Thank you.
Thank you very much. Speaking of the management of zoonotic diseases, maybe Dr. Agutu, you can help us understand why, as humans, considering that veterinary practices for animals, why is it important for us humans in consideration of what we call One Health, where we look at management of health across all species, so not just animals, but including humans, and how this affects us. Maybe you can tell us, especially we who own pets, or who are passionate about animal welfare, why this is important for us to engage veterinarians where necessary.
Okay, first things, viruses and bacteria and animal and disease-causing organisms in animals and human beings are similar. So if you have a bacteria, that bacteria could be the same one that affects your animal, or vice versa. Mostly for pet owners and animal keepers, it is important that when these happen, when your animals are unwell, that you contact a competent veterinarian so that they prevent it from getting into humans right from that level. For example, rabies. Rabies is a zoonotic disease. It affects animals and it affects human beings as well in the same measure. It is fatal, but it can be prevented at the point of the animal, because once the animal is vaccinated against rabies, then it would not get rabies, and therefore the human beings are protected. Now, when a human being contracts rabies, it is so expensive to treat, and mark you, it is fatal in human beings. It kills within 10 days, and it is horrible to see somebody who is infected by rabies. So we don't want it to get there. It is much, much cheaper. It costs maybe slightly, if very expensive, around 5,000 to get your rabies vaccine in the dogs, but that is on the higher level. Costs from between zero, because sometimes out of our goodness and our knowledge, we are able to get these vaccines and subsidize the costs. So like CASCAVA would do, they would offer free vaccinations for animal owners so that all those who have dogs and cats have them vaccinated, and that obviously would prevent such a tragedy to occur. Now, it is not only rabies that is a zoonotic disease, that is, it affects the animal and affects humans as well. There are so many. And right now, we are being told that out of around 75% of emerging diseases are actually zoonotic, that they come from the animals and they could affect human beings even worse than they affect the animals. So you need to have your veterinarian take care of your animals, especially when they get unwell, so that they are able to get a hold or stop the infection from the animals, so that it doesn't get to human beings. Now, one other very serious development is that the antimicrobial drugs that are used in animals are similar to those that are used to human beings. If it is penicillin, it is similar. And what has happened is with the time, as time goes by, microbials or infection-causing organisms are getting resistant to these antimicrobial agents. And so we are having a phenomenon that is being referred to as antimicrobial resistance. Now, when this resistance develops, and the resistance is developed, the microorganisms are developing the resistance so that they can survive. So you can imagine your dog gets an infection from a microbe that is antimicrobials resistant. And this microorganism, as fate would have it, affects you as a human being as well. You will also not get treatment. And that's why we are getting very simple infections that are now not able to be treated because of antimicrobial resistance that is developing out of careless use of antimicrobials. That is the reason why we are insisting that get your vet, get your whoever paraprofessional handling your animal, be registered by the board, be of known competence, so that they use these antimicrobials in a judicious way, in a prudent way, and not expose the whole race of animals and humans to microbes that are resistant to antimicrobial agents. So we are insisting that you use known vets who are trained, who are competent to treat your animals so that they don't mismanage the use of antimicrobials, which may develop which may have microorganisms develop resistance against them. So the vets, the paraprofessionals have been trained on quantities, on when to use, on how to use, on how to discard residues of animal products, for example, milk, immediately after use of some antibiotics or antimicrobials, so that we are not exposing microbes to the antibiotics and the antimicrobials, and then they develop resistance. So that is why we insist, use a vet who knows what they are doing.
All right, thank you very much. Which leads directly into the next question. Dr. Chibeu, you can take this one. How do we identify, as a client, assuming I've never been in touch with a veterinarian, how do I get to know who I'm engaging and whether they are well-trained, whether they have the right qualifications, and whether they're actually competent and registered? What are the things that I should be asking when I'm engaging a professional?
Actually, this question probably MTA would have been best suited, but anyway, I'll give it to you. It's fairly easy. I mean, most of us get referred to a vet by either your friend, your family friend, and you get introduced. Oh, I know a vet if you're looking for a vet. But one of the easiest ways of finding out the competency of whoever, or the validity of whoever is being referred to you, or whoever you're going to to see, is basically contacting the Kenya Veterinary Board. And the information is out there, and it is not difficult. The Kenya Veterinary Board, and I'm sure MTA will probably give you the numbers. The Kenya Veterinary Board maintains a register of it maintains a register of registered veterinary surgeons, and maintains a register of registered veterinary tech paraprofessionals in the whole cadre. Now, how does it maintain this register? Every year, for somebody to be maintained in that register, apart from fulfilling other conditions such as continuing education, the individual must be paid up by 31st of December of the superseding or preceding year. So if I want to be registered for the year 2024, I have to make sure that I've paid up all my Kenya Veterinary Board dues by 31st of December this year. What that means is that it's not just about paying that retention fee. There are other conditions that are attached to it. The conditions include you must have fulfilled some conditions such as having undergone continuing education within the year, subject to your respective cadre. So if it is a veterinary surgeon, you must have at least done 20 credit points for the year. If it is a paraprofessional, it is 14 credit points. And this is not just simple credit points that you get. You must, it means that you have to show that you underwent some form of continuing professional development. You went out of your way, and took time to actually further enhance your knowledge in whatever field you're doing. Then the board, on the 31st of March of the year you're supposed to be registered, gazettes the list. And in this list, it will include the details of whichever individual. And this is the telephone number, your location, and what you are registered for. So if somebody comes and tells you that I am ABC and I'm a vet, or you've been referred to a vet, that list is very public. All you have to do is go to the website of the Kenya Veterinary Board, click search, and you'll get it. If it is difficult, you call the Kenya Veterinary Board, and they will assist you. They'll give you the details immediately, and they'll give you the credentials, where the person works out of, and whether it's a registered veterinary surgeon or not. I hope I've done a bit of justice to that. Maybe MTA can add a bit on that.
Okay, in addition to that register, because we have the registers published and they are on our website, each retained individual holds an identification card. Now, that is what an animal owner, a pet lover, would ask for, a valid registration card for that year. So that card bears the face of the individual, bears their full names as registered, it bears a KVB registration number and their national ID number. Those are very important, and the validity of that ID. So the ID for 2022, they'll have the photos of the owner and that validity period. If you get a practitioner who has an ID that is not valid in the year, then you have no, that person is not validly registered for that year. For example, if one is written valid 2021, then why is he not valid for 2022? You are at liberty to reject his services and request for somebody who is validly registered. So if someone has no veterinary board identification card, you're supposed to contact us or to refuse services offered by them because they are not in good standing with us.
Okay.
Yeah.
All right, thank you. Now, there was something you had mentioned earlier, Dr. Agutu, when it comes to paraprofessionals and that they should be operating under the supervision of a veterinary surgeon. How then, what does this exactly mean? Does it mean that there's treatments they can give? And does supervision mean that the supervisor has to be in the same place? Or is it that they have to report back what kind of tasks maybe they've done for the day or for the week? What does that supervision actually mean?
That's a very good question. Supervision means that they operate under the delegated authority of the veterinary surgeon. So in case they are not able to do whatever is required of them, there is a vet surgeon behind them who you could always seek second opinion from, who you could ask for help, refer the case to. So every paraprofessional has a veterinary surgeon who they are licensed under to operate. This surgeon takes liability for what they do. So you could get a paraprofessional working on your animals, but you would also request them, can I also refer to the vet who supervises you? Now, there are things that paraprofessionals cannot do. Again, these are listed in the Veterinary Act, Veterinary Surgeons and Veterinary Paraprofessionals Act, Schedule 2, which clearly states what services a veterinary paraprofessional can help, can conduct. But it is obviously now outdated and due for review. So just find out which surgeon do you operate under so that I can contact them or contact the board and we could be able to give you that information. So for anyone to practice, they must be registered, retained, and licensed to practice. So the license for a paraprofessional is under a veterinary surgeon who supervises them. The license for a surgeon is under himself because he will answer for himself. Is that adequate? Okay. So it is not, oh, sorry, let me just add this.
Okay.
It is not that all the time the vet is with the paraprofessional. No, there are things like surgeries and complex procedures that the veterinary surgeon must be present, a CS, a spay, such things. But there are other procedures that are simple, deworming, AI. There are things that veterinary paraprofessionals can do with delegated authority without the surgeon. But in case there is a difficulty, then they escalate the issue to the surgeon. But they can operate. There are simple procedures that they can do on their own. Yeah. Okay.
So just in case maybe I'm not able to verify immediately this information, how do is there any quick way I can distinguish between a surgeon and a paraprofessional?
Yes. Yes. A surgeon bears or is a holder of a white ID card. White ID card from the veterinary board. And it is clearly written veterinary surgeon. The paraprofessionals also have ID cards. The degree holders have green cards, and it is clearly written veterinary technologist degree with a number, prefix VTA, and a number. Those that are diploma holders have blue ID cards, which have the number VTB and a number. Those that are certificate holders have is it cream or yellowish card, which is clearly written VTC. So if you get one with a blue, green, yellow card, those are paraprofessionals. One with a white card, that's a veterinary surgeon. So that's how you differentiate the three. Of course, the certificate has less knowledge than the diploma has less knowledge than the degree, but they are all veterinary paraprofessionals who must work under the supervision of a surgeon.
Okay. Dr. Chibeu, do you have anything to add to that? Or I can go to the next question.
Well, yeah, it's just that, and I think MTA mentioned it, whereas the regulations and the schedules are under and are supposed to go under review, it is important that people should know exactly what procedures that a veterinary surgeon and a veterinary that a veterinary paraprofessional can or cannot do. Okay, and for the purposes of this, which is a pet forum, a lot of the surgical procedures, in fact, majority of the surgical procedures, veterinary paraprofessionals cannot do. Mainly because they involve a lot of welfare issues as well. So, it is important to state that Whereas somebody says, yes, I know, I've seen, even those cannot be delegated. You cannot delegate a space to a veterinary paraprofessional. You cannot delegate a complex internal surgical procedure. You cannot. So the public must be aware of that. And I think the list is probably somewhere out on the veterinary, within the veterinary laws on what they can do and what they cannot do. It's very easy when it comes to livestock. It might be a bit different. But when it comes to pets, the restrictions are even greater.
Okay. Okay. So, I mean, based on the interactions I've had with both of you, you know that we've come across cases where there's mishandling of animals, there's malpractice detected. And the question always comes to what can the pet owner do with this case? So Dr. Agutu, maybe you can help us understand, if I encounter something, if I go through a such situation with a veterinary professional, how then do I seek recourse as a pet owner? What am I supposed to do and who am I supposed to talk to?
Okay, now that ID bears the contacts of KVB, and KVB should be contacted immediately. Now, the telephone numbers, I don't know if somebody's writing out, we have two numbers that get direct to the KVB. There is 0701 581 718. 0701 581 718. And the second is 0722 305 253. 0722 30 5253. Or you can write an email to the CEO. An email to the CEO. The email address is info at Kenya Vet Board, info at kenyavetboard.or.ke. Info at kenyavetboard.or.ke. However, this information is on that ID card. So before an individual treats your animal, they must give you their ID. If they don't have, let them not, because then you'll have no way of seeking recourse or seeking justice when they have messed with your animal. So all those who are registered and retained and bear the ID, you could use that to get their information. And through that, you will know what's their name, what's their number, what's their CADA. Yeah. When you have established that, you can always contact the board and say, veterinary paraprofessional, a veterinary surgeon, number this, named this, with this number, attended to my animal. The same as the police, they have numbers, so you can always refer to their number. And that is public information. That is your consumer right to demand an ID from everyone who attends to your animal.
Okay, and if I do report a case, is there specific information that you would prefer to have? Are there maybe things I should document? And is there a cost involved in reporting a case?
Okay, according to our service charter, there is no cost. Yeah. So what you need to know is the name of the person and official names. Yes. Derick is referring to me as MTA. There is no person that like that. Officially, I'm Mary-Theresa Agutu. So you must know their official name. You can only get that on their ID. You can only get that from their ID and their registration number. If you can't get the name, then get the registration number. Once you have those two, we will be able to respond to your distress call or whatever query you have. Yeah. Yeah, that is it. There's no cost to it.
Is there a timeline on these cases? Like, is there maybe an expected timeline for feedback? And in this case, are there specific consequences or general consequences? Essentially, what I'm trying to figure out is, if I have a case, what then happens? I've lodged the case with you, and then, because sometimes people say that they've not heard back from you as KVB, or maybe they feel that the consequences are not sufficient.
Okay. You're supposed to call us, contact us, and we are supposed to respond immediately. Give you feedback that yes, indeed, we have received your complaint, and that it will be handled. However, we have a discipline committee. We have a discipline committee that is formed by board members. The directors of the board form this committee. So what we do, we receive your complaint, we investigate as the secretariat. The secretariat will carry out the investigation, that is, refer back to the professional who is accused to inquire if indeed they came into contact with this animal owner. And then once the inquiry is complete, then a proceeding is launched if we find sufficient evidence that they actually committed a malpractice. Now, if not, then again, the owner is supposed to be contacted and told this is the position. However, you always have a right to complain and to be heard sufficiently. So most of the time, when we have a committee scheduled or convened, then you will come and give your evidence in their presence, and they will also give their response to whatever is being said. And this committee investigates and finds out, was there a reason that, is there sufficient evidence that there was actually a malpractice? If they are found to have done something wrong, then they can be deregistered and not allowed to practice again, or they are suspended from practice, or they are given a fine. And of course, after you have been fined, then you're required to behave professionally. So it is unlikely that you will complain and sufficient inquiry is not carried out. Actually, it may be the person who received the information who may be lax, but I want to state here that once you lodge a complaint, and it's always good to lodge a complaint in writing. You could make the call, but write so that there is evidence that you actually complained. Sometimes these professionals come in with lawyers. Even the pet lovers, the animal owners are allowed to come in with their lawyer, and the case is listened to like any other case. Now, if there is cause to appeal, then you can appeal to the High Court and you say, my case was not well handled, and these are the reasons why, and you can appeal. But the vets, the registered professionals, are handled by the discipline committee within the board, and the other people who are non-veterinarians, not registered, then you cannot complain to us. If you have a quack handle your animal, then that is an offense on its own. We can only be called in to give evidence that indeed that person is not registered. So it is important that anyone who touches your animal must be registered with KVB. Yeah, okay. For us to be able to help you.
All right, thank you. Dr. Chibeu, do you have anything to add? I'm going to open up the session to questions after this.
Sorry, Naomi, I sort of missed you out for that moment. Just.
Okay, I was saying, I was asking if you have anything else to add to what Dr. Agutu has said.
Oh, all right. Okay. One of the other things that I find amazing is that a lot of times pet owners especially complain a lot about what was done to their animal, what went wrong, and they never followed due diligence. One, due diligence means is the person who's handling your animal, your pet, qualified to do that, whatever he or she wants to do it. And then you end up finding, as MTA puts it, a majority of pet owners will go to somebody who is not qualified or competent enough to do what they require to be done on the animal. Something goes wrong, and they then blanketly accuse the veterinary profession. I would like to ask members of the public that, one, do your due diligence. Find that the person actually attending to your family member, the pet, is duly qualified to actually touch. You wouldn't take your baby to a witch doctor somewhere. So the same should apply in this case. Secondly, is that there are times people complain, and when the board requests for information, the same complainants then withdraw the complaint. Yet all the damage has been done. Especially, I'm looking at it from the point of professional standing, where they withdraw the information, or they simply don't turn up, and they actually hide the perceived culprits. I would like members of the public to do due diligence, and when called upon to produce or give evidence or provide information, to willingly do it. It's the only way we can clean up. We can clean up the profession, and then improve, make sure that your pets do get proper service. Okay.
Naomi, you're muted. We can't hear you.
Sorry, I forgot. Yes, thank you. I was saying thank you, Dr. Chibeu and Dr. Agutu. I'll now open up to questions. Anyone who has an issue that they want addressed on this topic. The vets are here, and there's many more in the room. So anyone who can assist on a question, feel free to speak up. Thank you. Or you can post the question in the chat. I'll see it.
There's a hand up by Robert.
Yep, Robert, go ahead.
Yeah, thank you very much. Thank you very much, Naomi, for this forum. And also thank you very much to our panelists, Dr. Agutu and Dr. Chibeu. My question is about what Dr. Chibeu said. There are restrictions. Sorry, my name is Robert. I'm a veterinary paraprofessional practicing in the University of Nairobi clinic. And mine was to Derick Chibeu on the restrictions of veterinary paraprofessionals in small animal practice. Looking at the services that can be offered by a veterinary paraprofessional in the Schedule 2, there are services and there are procedures. There are no those restrictions to practice written in the second schedule. So where are these restrictions, so that at least the public can know that there are services and there are also procedures that cannot be done by a veterinary paraprofessional? And moving forward now, there are so many clinics that have been opened in Nairobi and across Kenya. And with the opening of these clinics, there is need for veterinary paraprofessionals who are sufficiently trained to work in some of these establishments. Looking at the training of veterinary paraprofessionals, much of the training is mainly on the large animal practice, and not on the small animal practice. So what can KVB and CASCAVA do so that we can have qualified veterinary professionals that are primed to work in these clinics? I can mention one or two areas which they might be of interest to. Like one, during surgery, there is this anesthesia and analgesia. Veterinary nurses, veterinary paraprofessionals in other jurisdictions, they usually also are trained and to work as analgesia and anesthesia, veterinary professionals in anesthesia and analgesia. There are also veterinary professionals who are trained in medical imaging to assist in radiography and ultrasonography. Those are niches in small animal practice. There are also technicians trained in emergency and critical care. So how can we work together, the board and KESCAVA, to ensure that we have well-trained veterinary paraprofessionals primed to work in small animal practice, small and companion animal practice? Thank you.
Robert,
maybe.
Okay, so there's several questions.
MTA, you can deal with one, and then I'll deal with the other. Okay.
Okay.
Yeah.
So for Robert, I know you work in a small animal clinic or in the clinic at the university, and you're working there because you're under the supervision of veterinary surgeons. And so in their presence, you'll be allowed to do some of this. We are aware that we are limited as a country for now to train those anesthesiologists and emergency nurses and what. We will get there. Of course, with the world becoming a global village, these trainings will be open anywhere, and even Kenyans could train. So what we intend to do, and being dynamic and forward-looking Kenyans, the board will look at these courses and see whether they are the paraprofessionals could also handle them. For now, as we stand today, they cannot do those procedures without the presence, in the absence of a veterinary surgeon. And that's why Derick is saying for surgeries, for any type of surgery, internal medicine, radiography, whatever, there must be a veterinary surgeon in the vicinity before they undertake such procedures. So let's just leave them as that for now. Of course, in the near future, tomorrow, things may change and the laws are changed and you're allowed to do them. And of course, we are forward-looking and we are looking at this. These veterinary paraprofessionals who have worked in clinics, who have some experience, can develop the competence to be able to do that. But for now, it must be in the presence of a veterinary surgeon. The course, the training curriculum for veterinary paraprofessionals, whether a certificate, diploma, degree, has no surgery. It has no surgical procedures in it, and therefore, unless in the presence of a veterinary surgeon, please do not attempt. For now, of course, we have room for improvement in future.
Okay, thank you. Dr. Chibeu?
Yeah, if I may add, and I really would, I do feel what Robert is saying, and it's a very valid observation. And what MTA has said is basically the situation as it is now. And one of the main concerns in companion animal practice is that we are understaffed in terms of the quality of the staff that we need in our practices. We need properly trained veterinary nurses, and our veterinary paraprofessionals would probably fill that gap. But as it is now, the law and the curriculum needs to be reviewed and changed and improved upon to actually create the situation where we have legally recognized veterinary nurses, especially for companion animals. And I agree with Robert. We need our veterinary paraprofessionals doing anesthesia. We need our veterinary paraprofessionals being at the forefront of emergency and critical care. We need our veterinary paraprofessionals really at the forefront of nursing care in the practice. But at the moment, that is not legally is not in the legal frame. And one of the main problems is that in such facilities then is that you do not want to have a situation where we are now telling people that if something goes wrong, report to the Kenya Veterinary Board. And then we then end up then being the same ones who say, okay, we allowed so and so to do. So as far as some procedures are concerned, as far as some procedures, especially surgical, I'm not saying all procedures, I'm saying especially surgical procedures in small animals, in companion animals, those ones, there is no legal framework that allows paraprofessionals to be engaged in. And that would be landing somebody into trouble. That is it. But I basically concur with your thoughts, and I concur with what MT has said.
Just for purposes of clarifying, Dr. Chibeu, what do we classify as small and companion animals? Because I might have a lion as my pet.
Yeah. That's very true. It's almost like calling it how long is a piece of string. Let's put it this way: dogs and cats form your core small animals, okay? But in the emerging world as it is now, as MTA put it, the world is progressing. Right now, we are actually getting what they now refer to as furries. So your furries are you're getting people keeping rabbits, bunnies, guinea pigs, hamsters, the whole works as pets. You go to Europe and the developed world, you're getting chameleons, all sorts of pets. So basically, companion animals in this case is a misnomer. It shouldn't be looked at as just the dogs and cats. I know people who keep goats as their pets, pigs as their pets. So it's just a term just to say pets. Anybody who keeps it as a pet, as opposed to livestock, where it's a production animal. It's there to serve you by being a production livestock, the typical livestock animal.
Okay. There's a question here, and the question is, what does a law provide for pertaining, conducting postmortem and compiling reports? Who wants to take that one between the two of you?
Okay. I'll take that. Postmortems are also for surgeons because they are the only ones who can certify and write a report that is admissible. So let the veterinary surgeons do those as well.
Okay. And there's no specific law with specific details on that, or so it's just a medical report?
Okay, I'm looking at the second schedule, and it says basic postmortem examination and collection and submission of samples can be done by paraprofessional. But in the case that you may need to have a report written that is admissible in a court of law, it must have been done by a surgeon. That is not basic anymore. Yeah. So if you want to maybe seek redress or something, get a surgeon to do your postmortem examination. Yeah.
So the purpose is what matters there. There's another question. With the rise of general practice clinics, is the Kenya Veterinary Board having plans to have specialized clinics? And I guess that means it also relates to the specialization of the professionals themselves.
Derick, go.
Yes. I'm looking, when you're looking at specialized clinic, you're looking at your dermatologist referral, you're looking at your orthopedic referral, you're looking at your ophthalmology referral, and there is the basic requirement for this is that you must provide proof of how specialized it is, and then it will be registered as it is. But there's also another thing that you should not be confused with, where it says specialized colleges. Specialized colleges are a different entity, and basically, I think the driver of this is mainly usually colleagues in a specific field getting together and forming a college and running it as a college, and it's basically a standards college. It's one aimed at creating standards. But as far as a clinic is concerned, if I want to start a specialist referral clinic for orthopedics, I do not see why that would be a problem. But I think for the purposes of the board, you would have to fulfill what you say you are.
Okay.
If you say you're a specialist orthopedics, orthopedic surgeon, you'd have to prove, prove on how you're, that means providing the qualifications, the referrals, the whole works. Otherwise, we might as well all say we are specialist orthopedic surgeons.
Okay. There's one more question here. For vets who have been trained outside Kenya, so basically qualifications from another country, how are they allowed to practice immediately they complete their studies, or is there anything different they have to do then to when they come here?
Okay, we have different categories. They are Kenyans, but they are trained outside the country. When they come back, then we have to take them through an exam, a board registration exam, for them to be able to practice in the country. Then there are foreigners who have come to do maybe some research or something for a brief time. Those are also examined in the way the board feels fit, and they are given temporary registration. This temporary registration only has an expiry of 2 years, validity 2 years, after which they must seek registration again. But we are saying currently we have sufficient vets to work in this country. So if you are a foreign vet coming in to do some work, then the organization which has brought you in seeks temporary registration for you. So there's not so much of that. For example, ILRI has vets who have come in for a specific purpose, and they are so registered. Temporary registration to work in this area only and nothing more, because we have enough vets in our country. So they can't just come in and work here without our knowledge. So they must contact the Kenya Veterinary Board once they're in the country, and so that they can be given temporary registration to work here. Without that, no, we don't want, we don't entertain foreign vets practicing in our country.
But what if I want to settle here and I want to practice here? So I'm not visiting, I'm not under research, I am a vet elsewhere and I've chosen to move here.
Yeah, you must be a Kenyan, unfortunately, for you to be registered. So if you are a foreigner and you have come in, you will work on with a registered Kenyan vet, so under supervision. But as I've said, we are not allowing foreigners to come and work in Kenya, to come and practice in Kenya, because we have enough of our own. Yeah. So those who come in and are registered as Kenyan citizens, then are allowed to practice. We have several who came in and are Kenyan citizens. They're allowed to practice. The law says you must be a Kenyan citizen. So we're just protecting our own.
So not even residents, there's a classification for permanent residents.
Yeah, unless they are permanent and they are Kenyans, they have the Kenyan identification. They have been allowed to live in Kenya and be Kenyans. Those ones we will allow.
They're not allowed to be Kenyans, but they have permanent residencies.
No, those ones we do not allow. We don't.
Okay, and does the
It
same
must be a
apply for
Kenyan.
Kenyans going abroad?
Yes, it does. Unless they go and do their exams and have stayed there for long and they have clarified and verified their competence, then they allow them to practice there. But for us, the only other foreigners who we have allowed to practice in Kenya are those from the East African region. The East African region countries have what we call mutual recognition agreements, such that if a Ugandan trained in Uganda, registered by the Ugandan board, comes to Kenya, we will reciprocate. The Ugandan vet will be registered to practice in Kenya because it's that community. But others, no, within the East African community only.
Okay, thank you. I'm going to relaunch the poll that I had started at the beginning of the session. So for those who haven't filled that, just answer the questions for us quickly. And then as I do that, I'll ask another question, and this has nothing to do with today's topic. So any of the vets available can take it. There's a question here from Ivory. She says that she recently moved houses, and her cats, she has 2 cats, and they've been hiding since they moved house. There's one who she says is very greedy, but he's not even eating. And there's one who's very needy, and he's not even being needy. So their behavior has really changed. What can she do to bring them out of their fear? Is there anyone who would like to answer that?
Are these cats in the new home, or they're still in the old home?
No, they're in the new home now.
Ah, well, at least she should thank God they're in the new home. But anyway, but I see how, well, first of all, it's been a stressful situation for these 2 cats. They've actually changed their normal environment. They've had to move into a new environment, and their surroundings are very strange for them. And unfortunately, it will take a little bit of time for them to actually adapt to the new situation. And it is even easier that sometimes I usually tell some of my clients that when you move with your cats to a new home, it might be advisable that you actually put them in one room for a bit, so that they first of all get used to that room, get used to that environment, and they'll use it as a homing or a safe haven for themselves, so that even if they're walking out into the rest of the house, they actually know there's that one room where we stayed that we could actually go back to. But unfortunately, this will take some time. There's strange places, a strange new house, and of course, then the local neighbors will probably bully them for some time. So it may turn out to be a bit stressful for them, but it will go off. There's nothing more you can do, but it will go away.
All right. So Ivory, I'm sure you're 2 rascals. I happen to know them. Ivory is my friend. So I'm sure they'll be fine. We'll see what to do to help them settle in. All right. Is there anyone with another question or who feels their question has not been adequately answered? Ivory, Dr. Edward adds to your question. Maybe if there was a cat that lived in that house before, maybe you need to find out from the landlord. They might have left their scent around, or then you just have to do a bit more cleaning around the house, but I'm sure they'll be fine.
Thanks, but no cats before. But I'll just work on coaxing them out.
Okay. Sorry, I forgot Sarah Jamal's question. Thank you, Sarah. If I can go to your question. She was asking, is there a list of suspended vets or maybe vets with disciplinary restrictions around them? How do we know? And especially suspended vets, because we find that sometimes maybe someone is dismissed from practice and they still practice, and anyone who does not know to verify who they are does not know that. How do we know who we're engaging with?
Okay, as I said, the ID
Yeah.
is one document that you can never go wrong on. Demand for a valid ID. Anything without that validity is not admissible. So anyone without that, don't even go to them.
Mhm.
Yeah. So unless it is ID 2022, then they are valid. And you will find them on the list of veterinarians for the year, the registers that we put on our website. Yeah. So anyone without that ID is not registered for that year. Without an ID is not registered for that year. So don't compromise. Don't compromise on that.
Sorry, Dr. Agutu, the list is updated every 31st of December, or when is it updated?
It's updated
31st of
every
March.
31st of March. 31st
31st
of
of
March. Yes.
Okay.
After that, those who update their status have the ID. Yeah.
Okay.
After 31st of March, those who update their status have a valid ID. So they must be in possession of an ID.
Okay.
Yeah.
Well,
So they may not be on the register online, but
yeah.
they have their ID.
Yes.
Yeah.
A valid ID.
Yeah. Basically, what MTA is saying is that you get a gazetted list. That gazetted list is what is ideal. Everybody aims to be in that gazetted list on the 31st of March. But you find there are issues, there are problems. You know, you don't have money, you're out of the country, you know, things you forget. You don't get into that list. But you regularize yourself as soon as you get in after the list has been gazetted, and you get your ID. But over that said and done, is that the KVB still maintains you on a list, on a specific list. It's not necessarily that gazetted list, but it maintains and does actually certify when you're in good standing. So always, if you can always check, and I'm sure MTA can probably, if you liaise with her, she can probably give you a list of the current registered members of the profession.
Okay. All right. Thank you. There are no other questions that I see. Anyone else with a comment or question? Please feel free to unmute yourself. Okay. Thank you.
Naomi.
Okay. Yeah.
Perhaps I do have a comment. I remember when we were starting out, you did mention. I don't know whether the poll results, you have them there, and you could probably, if you can just run through them, and then one of the reasons was expense. So I was thinking that maybe I'll make a comment about that.
So, okay, so the results are there. 9 people have answered so far. All 9 have engaged a veterinary professional. The encounters were between good and great, so that's good. And their biggest hindrance comes down to the cost and expense. And the other bigger hindrance is that there's none in the area. So, yeah. You can see the results.
Sorry, you said there were 2 hindrances. One was the cost and one was something else.
The cost and the availability in their area.
Is that availability of the vet?
Yes, yes. Okay. So, you know, maybe it's how when it comes to availability of the vet, what I usually find is that they expect a vet to be very close to them, right in their neighborhood, and not necessarily someone who can attend to someone in that area. So for example, if I'm in Kilimani, I'm not expecting a vet to come from Kileleshwa or from Ngong Road, you know, that far, or even Westlands. They want the vet to be right in their area. That's what I generally find.
Okay.
Yeah.
Well, I can't comment to availability because sometimes it's, you know, otherwise would have it's not easy to have vets available in every area. There must be some, you will find that some people must have must take some distance to actually go to see a vet. But I'm sure, generally speaking, especially when you're looking at pets, I think the general availability is good because there are quite a number of clinics. I would like to address the issue of cost, and I think this is an issue that has been canvassed variously in a lot of social forums.
Yeah.
I would like to point out to the general public that veterinary costs are actually very subsidized in this country, more subsidized than you would actually imagine. And two, one of our greatest undoing or setbacks or changamoto, real big problem we have as veterinarians is credit control and credit availability. One, it is very difficult to get credit as a veterinarian, though we are professionals. So it is very difficult to really establish a clinic and get something running to what you actually see. For some reason, the credit facility or facilities or people that offer credit facilities have not really realized the potential of the veterinary profession on that aspect. When it comes to credit control, vets suffer terribly in terms of payments. Vets are constantly in trouble when trying to get payment out of their clients. And when you look at the wellness index in the world all over, vets, this is one of the biggest problems for vets in the world all over, and it contributes greatly such that the veterinary profession is about 4 times more likely than any other medical profession to commit suicide. Mainly because of issues like debt, client non-compliance. So when clients say vets are expensive, and I know that in this country we are subsidizing a lot. Case in point, a veterinarian to establish a clinic has so many licenses to pay. One is to pay the license of the Kenya Veterinary Board. And for you to get the good services that a clinic must offer, you have other services, other licenses that you have to pay. If you have to have an X-ray unit or even a scanner, forget an X-ray unit, you have to pay to the nuclear authority. Fees, and not only that, do an impact assessment of whatever equipment you have that amounts to almost 100,000 bob every year, and this doesn't stop. Then you've got to keep staff there that are 24 hours because, as somebody says, vets are not available. So that means we have to be there 24 hours. Staff that you actually pay, you have to pay overtime because they're not doing the regular thing. They will not put them on a regular thing. You have to pay for the facility. If you're in a rented facility, you've got to pay for the rented facility. Over and above that, you have got to then be able to offer a service that is comparable, essentially good enough. Because I hear a lot of people complaining that it didn't happen, this didn't happen, and basically we've got to buy the same equipment as hospitals buy. Now, if you compare us with our medical colleagues, people will go to the medical facility and pay upfront without seeing even the doctor, and come out of there 5 minutes later, having been written a prescription. Whereas in veterinary facilities, clients want to come in, see the vet first, get their animals treated, get their animals tested, get their animals x-rayed, and then treated to proper full recovery before they even pay. All these things cost money. We must learn to appreciate what the vet bends back. And I want to appeal to especially you, Naomi, because you're in the social media sphere, to point these things out. because I see a lot of bashing of veterinarians that is not justifiable at all. That is my only appeal to the public. There are a lot of more things to consider than just, it's not just coming in there and an injection. One bum, thank you, ma'am. There's a lot to consider. You will go to the doctor and explain the problem. Whereas somebody brings the animal to us, we have to work out the problem.
Yeah, animals cannot speak, so you're the
Yes.
ones who speak for them.
Yes. I rest my case.
Thank you very much. And it's one of the reasons why I created this forum. I need people to understand the practice better and what it takes to actually get to practice, but more so to put that importance into why animals too. Sorry, my assistant Karen here is very busy today. Why the individual must place the same responsibility and care on their animal without, I mean, people just think it's an animal, so they don't care much for it. They don't place that much value for it. After all, it's just a cat. They can get another one. It's a dog. They will get 10 more. So that is one of the reasons why I created this forum. I just need people to understand how to take care of their animals better and try to do the best they can. Of course, there's those who really love animals but can't, they don't have the full resources to give them the best of lives, but they can try and do as much as they can as possible and then get help when necessary. So thank you for sharing that when it comes to the understanding of the cost of taking care of an animal. That said, then, unless you have something else to add, Dr. Chibeu and Dr. Agutu, I'll let you have the last words.
Okay. I'd just like to say thank you very much for giving us this opportunity to demystify some of this information that the consumers actually have a right to. So anyone who would like to reach us, there are those KVB numbers. In addition, there's also my number, which you can always reach out on 0722 98 3405 722 98 3405. Our offices are located at Upper Kabete. When you get to Ndumbuini Junction, while heading to University of Nairobi, Kabete campus, then you would detour. But I think we are on the Google map. If you search for Kenya Veterinary Board, you will be brought direct up to our offices. So you're all welcome. Anytime, come and we chat and get a way forward for our beloved pets. Thank you very much. Have a great night.
Thank you. Dr. Chibeu, anything else?
No, I'd like to thank you and of course thank everybody who's participated in this. I think we should have many more. And my only request is for the members of the public, especially, is speak to your vet and come to an understanding. I know times are difficult, and especially when it comes to issues like costs, procedures. I think you can always work out, and I think I would like to encourage the public to be more open to working out payment plans, payment schedules, procedures, and always seek your vet's advice. I wouldn't want to really blast it and be condescending, but social media will not give you the right advice. I see a lot of advice coming through on a lot of the social media, but the best advice comes from your vet. So get close to your vet, work with your vet as far as looking after your pet.
All right. And Dr. Chibeu, are people free to contact you?
Yes, by all means.
Both as a vet and in your role as CASCAVA?
Yes, yes. I'll send you the details, the email addresses for CASCAVA, and yes, they can, if there's a complaint, there's something, an issue they want raised, we are ready to work. It's all in promotion of good welfare for our patients and our animals and our care.
All right. Thank you very much. Thanks everyone for taking time. I know the evenings is difficult sometimes for everyone, but this is the best time we could find to have these sessions. We'll try and hopefully make them at a better hour if we can. But for now, we remain as Monday, 6:30 to 7:30. Please share this with your friends. The recordings for the first 3 sessions, so this is the 3rd session, they should be up. We'll have a YouTube channel for this, and the recordings will be placed there by the end of this week. Next week, though, because of the elections, we won't have any session. A lot of the vets are not available to do this, so we'll skip next week and come back after, and that will be the 15th. The next session will be on the 15th. Thank you again for indulging me and for my guests for being here, and to all of you who attended the session. I'll see you in 2 weeks. Bye.
Bye. Thank you, Naomi.
Thank you.
Bye.